No, so I thought, do I have real cancer?
It was once considered a death sentence. Now, many women with breast cancer are finding out they have options and reasons for hope. Tonight, we take a look at some of the latest advances and what doctors are learning about treating and beating breast cancer.
I wrote a song, you know.
Marcia Chun, diagnosed less than a year ago, worried at first, even wrote a song about it.
There are days when I am worn by the way life's treated me.
Her grandmother died of cancer, but 6 songs and a full slate of help later, she's learned the disease is not only treatable, but beatable.
Cancer today is so different from cancer so many years ago.
Dr. Kathleen Ma, Chun's doctor, specializes in treating breast cancer at the Queen's Medical Center.
So there was a time where a woman had a lump, they would go to surgery and the surgeon would tell them, if this lump is cancer, we're going to remove your breast.
Dr. Ma says imaging is so good now, she compares it to switching from analog to HD TV. And technology is so sensitive, it can even pick up a hint of cancer.
How small are we talking about here, potentially?
Microcalcifications like fairy dust.
From the very beginning, when the doctor broke the news to me, she said, this is curable. You are at stage 0.
Stage 0? Well, most people haven't heard of it, nor did another patient of Dr. Ma's, Deidre Harrison.
No, so I thought, do I have real cancer?
That microcalcification, there it is. And if they also find a lump,
we'll put a needle in it.
Dr. Ma says her patients are coming in earlier, catching cancers sooner, and having more options for treatment. Removing just the lump or even a few lymph nodes, some chemo, some radiation, a combination, or neither.
80% of the time it's going to be benign, meaning not cancer. We don't have to do anything.
She says they're also learning what's called a cancer's personality, how it behaves, and how it affects each person differently, depending on their genetic makeup, body type, health, and so on.
I think most people approached it like, oh, we're so sorry. You know, it almost felt like, no, I'm not that kind of cancer. I'm early stage. I'm going to be okay. I'm curable.
Harrison is sailing through treatment, and so is Chun, both poster children, they say, for early screening and a positive outlook on cancer.
If I can help somebody else, that's what I want to do. So I look to you, and you are there to guide me through an hour of prayer.
Just one of 6 songs she said she wrote. Well, Dr. Ma says nearly 98% of patients, breast cancer patients, get needle biopsies, often preventing surgery. She also adds clinical trials have been critical to their work. Dr. Ma says willing participants have been key to them learning what they know now about treating cancer much better. We can make a difference in the fight against breast cancer by participating in the Komen Race for the Cure. That's this Sunday at Kapi'olani Park. Now, there's still time to register to find out how and to learn more about the race. Just click on the breast cancer section of KITV.com.